The 27-year-old female victim is currently undergoing treatment at the Kenyatta National Hospital. And Leila Mohammed is currently at the hospital, and we cross over live to her. Leila, what is the situation like on the ground at this point?
Well, Zainab, we are in the middle of the city. We moved from the hospital a few minutes ago. Now that the conversation moves from the isolation area at the KNH to public spaces like this one in the central business district, where there is a heavy movement of people going in and out of the city. The government says that everything is ready in terms of dealing with the contamination of this virus in the country. If I can just read a statement from the National Security Council, the president who chairs that committee says an emergency session of the National Council was given today. They are looking at the national security infrastructure be mobilized so that there is an emergency response. These are some of the issues that we were dealing with earlier since this outbreak in China over a month ago. China has since stopped the announcement of new cases down from 15,000 a day to 15 only in the last few hours. So Kenya, with this initial announcement of the first confirmation of this virus within the confines of Nairobi, probably Kenyans will be looking at how they behave in public spaces using public transport. How do they ensure that they keep themselves away or stay clean, wash their hands, and do many things to avoid cross-contamination of this disease. This lady came into the country on 5th of March. She was able to get quarantined 4 days later. Who did she talk to? Who did she speak to? Who is currently taking care of her? The ministry says that this is under control and Kenyans should not be worried, and they are following up on all the people that she interacted with since coming into the country from the United States via the United Kingdom. So public spaces should be the next point of concern. Now that we have 2 centers already for isolating these people, this patient is at the Kenyatta National Hospital, and that is where she was tested, and the first confirmation having occurred in this particular country. So Zainab, nothing much is going on at the Kenyatta National Hospital. What indeed we were looking at is how Kenyans are behaving in their open spaces publicly. I know the Minister of Health has already said that he is banning public gatherings. This is a political or any sort of that matter, just to ensure that not more contamination continues in this country. So for now, this is the match that we can be able to bring to you at this hour.